Part 1, How to Mix Your Peptide Injections. Step 1. Start by washing or sanitizing your hands. Use soap and water or hand sanitizer before touching anything in your kit. Step 2. Next, grab your kit. This will have been delivered to you by mail. Step 3. Open the kit and take out all the contents. You should have a 10 cc syringe with a needle for reconstituting, your peptide vial containing the powder, a 30 milliliter vial of bacteriostatic water, alcohol prep pads, and your instruction sheet. Step 4. Remove the snap caps from both the powder vial and the bacteriostatic water vial. Step 5. Clean the tops of both vials with an alcohol prep pad and allow them to dry. Step 6. Assemble the mixing syringe by attaching the needles securely to the syringe hub. Step 7. Draw up the bacteriostatic water by pulling the plunger back to the volume listed on your prescription. Step 8. Transfer the bacteriostatic water to the powder vial. Push the plunger into the bacteriostatic water vial, then slowly pull back to draw the prescribed amount. Remove the needle from the water vial and insert it into the powder vial. Slowly push all of the water into the vial. If the vial is under vacuum, the water may flow in on its own. Then, draw out the same volume of air you injected to keep the pressure balanced. Step 9. Mix gently by swirling the vial until the solution is clear. Do not shake. Step 10. Place the reconstituted medication in the refrigerator and store it as directed. Part 2. How to administer your injection. Step 1. When you're ready to inject your dose, start by wiping your chosen injection area with an alcohol swab. Then administer your treatment as instructed. If you have any additional questions, please contact your provider.